Hi, today will be medical talk number 10. It will be about kidney number 3, chronic disease, chronic kidney disease. So introduction. Patients on dialysis require courage. They will so dialysis is the ultimate treatment for CKD, high serious stages. Patients will feel terrible because a lot of waste in the blood. 6% of adult population in US have CKD, means chronic kidney disease. Chronic means cannot reverse anymore. Chronic mean so stage 1 and 2, 6%. Stage 3 and 4, 4.5%. Stage 5, I'm not sure. Stage 5, I think maybe 0.5% or less than 1%, 0 point something percent. So you can see more than 10% of the adults in US. In Malaysia also is probably not as maybe slightly lower, but it's still in the range of 9 to 10% in Malaysia. The most frequent cause is diabetes, and when you have CKD, you also have often have hypertension, means high blood pressure. So get high blood pressure, buy a machine to test at home also can, you know. Kidney problems lead to uremic substances. Uremic means toxins. Other functions cannot be performed, like hormone, electrolyte homeostasis, and nutritional things, which I already explained in video number 2. So uremia means if you got too much toxins in the blood, every other organ will have problem. So dialysis now can remove uremia. Last time cannot. Okay, 10 or 20 years ago, they couldn't. So now the latest one, they can. I read they can, and but it cannot perform the other functions of the kidney. And I also read it's very high risk for young males working in agriculture. It could be due to toxins in the agriculture, like they spray pesticides, herbicides, uh, or is it fertilizer, chemical fertilizer? I'm not sure, or maybe it's in the water they drink. So all these chemicals can cause kidney disease. So how to know there's something wrong with your kidney? So this is the picture. You can test. First is the blood pressure. You can test the blood for creatinine or electrolytes. Then you test for protein in the urine. You test for nitrites and leukocytes in the urine. Then you do abdominal examination. So if you can touch your kidney from the outside, means something is wrong already. Means your kidney is too big. Yeah, means it's and then it is very soft at the there's tenderness at the renal angle, and then they can do rectal examination for prostate and assessment to see the prostate. Yeah, so they can check the leg whether got edema or not. Edema means the leg is a lot of water inside So this is some of the signs. These are some of the signs that is shown. You see the body got one. Number 1 is the hand. Your fingernails, you can see some blood in the fingernails. And the fingernails got a lot of line on. A lot of lines on the fingernail. Number 2, of course, is the skin. Yellow. Your skin will look yellow in the late stages. And all these you can read yourself. So blood pressure, and then you look at the eye. Number 5, if you look in the eye, you can see there will be some changes in there also. Due to hypertension. Number 6, got some fluid in the lungs. So when you put a stethoscope, you can hear some fluid inside. Yeah. So this is a bit of physiology about the kidney. So the last talk I say that it is yeah, active transport. So if you look on the right hand side, you can see sodium can go in, right? Sodium phosphate go in, and then glucose can go out, amino acid can go out. So it's all cellular cellular transport. Is not osmosis anymore. Of course, the principle of osmosis is still there, but it, it is a cellular active transport from the cells. Yeah, when the kidney want to perform its function. This is also some of the pictures you can watch, see yourself. And this is a normal kidney. So this is, you can see the picture here, a lot of yellow dots because the blood pressure is too high. So all the waste, all the good things, all the protein, the yellow dot is the protein. All the protein come out from the blood, go into the urine. And this is, and what happens is the blood pressure will make the hole bigger, right? The vessels will become bigger. So enlarge, you can see enlarged arterioles. Yeah. Sclerosis means scar lah, you got scarring. So, because it's a hyperfiltering. Hyperfiltering means due to high blood pressure too high. This is a normal glomerulus, hyperfiltering glomerulus. So what is the treatment? So my understanding so far, if you treat the diabetes first, you must treat the blood pressure. Then you must treat the electrolyte imbalance. If you got too much potassium in the blood, then you must lower the potassium, you must lower the sodium first, right? Then you must change. If sometimes you got diabetes, you eat drugs because of diabetes, you cannot eat so much now. You have to eat only like maybe 50% because the kidneys cannot remove the drug so fast. So the drug dosage have to reduce. Some studies ask people to do dialysis before stage 4. Normally dialysis is stage 4 or stage 5, right? Some they say ask to do maybe stage 2 or stage 3, start to not stage 2 lah. I think maybe stage 3 they ask to do dialysis already, so that you can last longer, you can live longer. Don't wait they say don't wait until you are sick then only do dialysis. Start dialysis when you are still okay. Yeah, but there is no data lah on how effective this method is lah. Okay. So dialysis can be done at home. It is less expensive and improve quality of life. But this is US. I'm not sure about Malaysia. Dialysis is basically a solute diffusion across a semi-permeable membrane. Waste products move down a concentration gradient from the circulation into the dialysate. Membrane thickness and surface area and flow rate determine speed. Yeah, so you can understand. It's very hard to explain in simple terms because there's a lack of time here. Yeah, but you can always ask me if you're not sure what is hemodialysis, HD. So this is how the concept works. The blood flows from the arteries, the red color one, goes into the machine lah. Then this machine, it comes to the blue color one. Yeah, so the comes to the blue color and then it goes into a circular loop. So when it's inside this blue color machine, this dialysate means the clean water lah. It's some sort of water that they put some acid or some good things inside. So the water, the new liquid lah, not really, it's not water lah, it's water with something inside. It will mix, it will go inside this tube, white color tube, and then the blood will, the dirt, all the waste from the blood will go inside the tube, the white color tube, and then the white color tube will come down and then it will drain, dialysate drain, and then the clean blue color blood will go back to the veins. Okay, so more about dialysis. The flow rate, okay, you can see dialysate flow in opposite counter current. Okay, so dialysate go from left to right, then blood go from right to left, so that you can mix faster. And different machine have different efficiency. Okay, some old machine not so good. Yeah, so choose the latest technology lah. And if it's not efficient, if it cannot remove enough urea, the patients die early. So efficiency must be enough. Normally 9 to 12 hours each week, and divided into 3 sessions. So each session about 3 hours, 3 to 4 hours each session. But they did studies, they did a new experiment. They find that if they go 6 times per week, maybe 2 hours each time, 6 times per week, then it controls their hypertension and their phosphate levels and other things. The patients say they feel better. Okay, they give better feedback. So, and those who like to take weekend off means Friday they go, Saturday, Sunday they don't go, then Monday they go again. those people die very early. So even Saturday or Sunday, one day you must go, right? Every 2 days once, yeah, minimum. So those so and in poor countries they use peritoneal dialysis. They cannot afford hemodialysis, so they use peritoneal dialysis. You can see what is peritoneal dialysis later. So this is problems with hemodialysis. You want to read, you can read. What are the problems like high blood pressure and breathlessness. So on the first diagram, A is hemodialysis. B is uh, artificial kidney, right? B is some sort of filter lah, filtering. C is peritoneal dialysis. Peritoneal dialysis means you pump water into the stomach and then you wait for the dirty water to come out. Uh, and then so you don't. I think lah, peritoneal dialysis don't need a machine. And then it's not. And then transplantation, D is organ transplant lah. So there are 4 main treatments lah. So in conclusion, there is we learn how to diagnose, how to tell if a person has CKD. But of course, CKD is very silent. The signs and symptoms usually come when it's very serious. But the main one is look at the fingernails lah. Okay. Um, then we learn about the physiology, right? How the kidney works. We learn about some treatment, what kind of problems with treatment you can have. So I only cover about 10% in the book. There's much more to learn. And when I learn more, I will update with another talk. Okay, thank you.